Let's have a look at the next slide. It's again showing you the antipsychotic drugs. Traditional or older, I've divided them into two groups, that's low potency and high potency. And on the right side, the last column, is the newer agents. Amongst the low potency agents, you have chlorpromazine, thioridazine, thiothexine. And in the high potency, you have haloperidol, penfluridol, flufenazine, trifluoperazine, pimozoid, and perfenazine. What's the difference between the low potency and the high potency agents? The low potency agents, chlorpromazine, thioridazine, etc., they comparatively have less extrapyramidal symptoms. We talked about the D2 blockade and about the extrapyramidal symptoms. The low potency agents, they have got comparatively less extrapyramidal symptoms and they produce more anticholinergic effect. I hope you remember there is balance between the dopamine and acetylcholine in the brain. So they produce less extrapyramidal symptoms, that's the dopaminergic blocking symptoms, and they produce more anticholinergic actions. The high potency drugs, that's the haloperidol, penfluridol group of drugs, they produce more extrapyramidal effects. They are high potency, it means they have got the more potency for blocking the dopaminergic receptors. This is how you can remember. They produce more extrapyramidal reactions and their anticholinergic effects are less. And once again, I feel we should pronounce loudly these names so that you can remember the newer antipsychotic agents which are most commonly used these days. And I have colored them separately. The three pins are given one color. In between there is aripiprazole, a very important new agent. So it's got a highlight. And lastly, there are three agents ending with DONE. That's D-O-N-E. Clozapine, olanzapine, quetiapine. The blue one is aripiprazole, a new agent. And the last three with DONE is risperidone, ziprasidone, and paliperidone. So I hope you will remember the newer agents. They are now most commonly used. What's the difference between the traditional versus atypical? Traditional agents mainly act on the dopamine. They mainly block the D2 receptors, dopaminergic 2 receptors, and they mostly treat the positive symptoms, and their adverse effects are more, and they are less useful if the disease becomes refractory or the disease becomes old or resistant. Whereas atypical agents, they do block dopaminergic receptors, but they also block 5-HT receptors. That's their specialty. They block the D2 receptors just like traditional, but in addition, a very important receptor which has been shown to be blocked is D4 receptor as well as the 5-HT receptor. They treat the positive symptoms, but they also treat the negative symptoms of schizophrenia. That's the great advantage. They have less adverse effects as compared to the typical antipsychotics, and they are useful in the refractory disease. So you can have a look at this particular table in the form of which is shown in front of each other. Traditional mainly dopamine, atypical dopamine, and 5-HT. Traditional D2, atypical D2 yes, but more importantly D4 and 5-HT. Traditional mostly positive symptoms, atypical positive as well as negative symptoms. Traditional more adverse effects, atypical less adverse effects, and traditional less useful in the refractory disease and atypical useful in the refractory illness. Let's start discussion of the antipsychotic drugs. When you face your questions or when you face life, you might hear different kinds of names for the same drugs. So all the names here written here on the top, it means the same group of drugs. That's antipsychotic drugs. They are also called major tranquilizers. They are also called neuroleptics. They are also called ataraxic agents. This word is sometimes likely to be a bouncer for you. Ataraxic, or they are the anti-schizophrenic drugs. And the prototype of this particular group is chlorpromazine, many times abbreviated as CPZ. And as we said, it's a traditional antipsychotic, the prototype, so blocks mainly the D2 receptor. The most important action which chlorpromazine has is called neuroleptic action. That's the antipsychotic action. What is this neuroleptic effect? It produces a sort of indifference and psychomotor slowing and quietening in the patient. The patient is as if it's a tamed animal and is going to follow your orders because the patient has total indifference about the surroundings. There's psychomotor slowing and quietening because this patient earlier was in aggression and now the patient is becoming quiet and patient has the psychomotor slowing. Chlorpromazine also decreases the agitation and aggressiveness and the irrational behavior, anxiety and hyperactivity. All this together is called the classical neuroleptic action of chlorpromazine. Chlorpromazine has got additional actions, and it's important to know these additional actions. Number one, it blocks D2 receptors, so it can produce the anti-emetic effect. It can increase the prolactin and it can increase the appetite. It blocks the alpha receptors, so it produces vasodilation. This could lead to fall in the blood pressure. It blocks the H1 receptors, and just now we discussed what's the H1 blocker. It's sedation, increased appetite and weight gain. I hope you remember. It blocks the muscarinic receptors, so it could lead to the muscarinic actions like dryness of mouth and retention of urine. It obviously has anti-5-HT action, which can produce sedation and increased appetite. Has also got mild local anesthetic activity and suppresses the myocardial contractility and decreases the blood pressure. So there are so many additional actions of chlorpromazine, and due to these additional actions, I hope you understand. You're not feeling great that chlorpromazine has so many actions, but having all these actions is like having so many adverse effects with chlorpromazine. And what was useful to us was the first most important action, that's neuroleptic action. So this tells you what's the gist of the traditional or typical antipsychotic drugs, that they got too many actions and they produce too many adverse effects. Next we discuss what are the adverse effects of chlorpromazine.